My name is Tyler Sandahl. I am a clinical pharmacist working in the multiple myeloma clinic at the Mayo Clinic in Rochester. I work primarily with patients to educate them on their treatment regimens, help them with supportive care issues, and spend a lot of time teaching pharmacy residents and pharmacy students about the management of patients with cancer and especially plasma cell disorders. So tocilizumab is an anti-BCMA directed bispecific agent used in relapsed refractory multiple myeloma after at least 4 prior lines of therapy. We looked at tocilizumab use in real-world patients using retrospective chart review with electronic medical records from the Mayo Clinic. Our patient population included adult patients at all 3 Mayo Clinic sites in Rochester, Minnesota, Phoenix, Scottsdale, Arizona, and Jacksonville, Florida. At the time of data cutoff, we included 49 patients who had received at least 1 dose of tocilizumab across all 3 locations. 45 patients completed step-up dosing as of the time of data cutoff, and of those 45 patients, 41 of them completed step-up dosing in the outpatient setting. So our goal here, objective, was to evaluate the safety outcomes and healthcare resource utilization in the real world for patients using commercial tocilizumab. So looking at our patient characteristics, 31 patients had myeloma with high-risk cytogenetics, and 17 of them did have prior BCMA exposure before receiving tocilizumab. In terms of what step-up dosing schedule they used, 45 patients completed the step-up dosing, with 56% of them receiving it on a 3-day schedule. So for example, on days 1, 4, and 7. The mean time between first and third doses was 7.8 days. For safety outcomes, all patients received acetaminophen and diphenhydramine as pre-medications, and almost all of them received dexamethasone. There was 1 patient who received prednisone due to dexamethasone intolerance at an equivalent dose. Among the 45 patients with complete step-up dosing, 13 patients developed cytokine release syndrome, with the highest CRS grade being grade 1 for 10 patients, 2 patients with grade 2 CRS, and 1 patient with grade 4 CRS. A total of 7 patients had recurrent CRS, including 2 patients who had 3 events during step-up dosing. All patients who developed CRS during the step-up dosing were admitted to the hospital for treatment and observation, with a total of 22 admissions across all patients with cytokine release syndrome and a median length of stay of 1.7 days per admission. Among patients who were admitted, they were mainly treated with acetaminophen and dexamethasone. Tocilizumab was given to 5 patients for treatment of CRS. A total of 2 patients developed ICANS during step-up dosing. Both of those were admitted to the hospital for treatment, and both resolved so they could continue with tocilizumab treatment. So among the doses with clinic time data, which was 99% of them, the majority of doses during step-up dosing required 30 minutes to an hour of clinic time for monitoring between administration and checkout times. After step-up dosing, the clinic time for weekly treatment doses decreased to less than 30 minutes for most of those doses. The study evaluated the real-world safety outcomes and resource utilization for patients receiving tocilizumab in an outpatient setting, and shows that outpatient administration is both safe and feasible. So this data can be really important for frontline practitioners. I think there's been a lot of hesitancy in the myeloma community to move step-up dosing to the outpatient setting. But what we've seen from our experience is that with appropriate monitoring, it can safely be done if you have the availability of rapid escalation of care for those who need it. I also think, the more time we have with these drugs and the more experience we gain, smaller community practitioners may start to gain a little bit more comfort, maybe not using these in the step-up dosing period, but transitioning more maintenance dosing out into the community as well.